Thank you for the opportunity to present our research. Today, Dr. Aruradian and I will discuss our Phase 1 study of intra-anal artesunate suppositories to treat anal high-grade squamous intraepithelial lesions. This investigator-initiated study was funded by Fang's Viral Therapeutics. In the U.S., the overall incidence and mortality of HPV attributable anal cancer continues to increase. According to SEER data, in 2024, there were 10,540 new cases of anal cancer and 2,190 deaths. Up to 95% of anal cancers are caused by human papillomavirus. Current standard of care treatment options include ablation and surgical excision. The Anchor study showed that treating precancerous anal lesions can significantly reduce the risk of progression to anal cancer in patients living with HIV. The current options of ablation and surgical excision do not cure HPV, and thus anal H-cell recurrence is high. This is a Phase 1 study that determines the safety and tolerability of self-administered artesunate suppositories in the treatment of anal high-grade intraepithelial lesions. The secondary objectives include evaluation of histologic regression and clearance of HPV after treatment. This is an investigator-initiated, prospective, open-label 3+3 dose escalation Phase 1 clinical trial that was conducted at 2 academic tertiary care referral institutions. All HRA clinic patients with the diagnosis of anal H-cell were recruited to participate in this trial. They were counseled about standard barrier precautions for pregnancy prevention, as well as to control for additional HPV infection that could occur during the study duration. This is a 3+3 dose escalation. Patients self-administered 200, 400, and 600 milligram suppositories daily in 5-day cycles for 2 or 3 cycles. Patients underwent an educational session on how to place a suppository effectively to target the dentate line during their first dosing visit. Anoscopies were performed after each dosing cycle to assess for local adverse effects. Follow-up high-resolution anoscopies were performed at 3-month intervals. At week 16, if patients did not have complete resolution of anal H-cell, then they were offered standard ablation of their anal H-cell. Patients were followed for a total of 40 weeks. Safety was evaluated by dose-limiting toxicity while identifying any grade 2 or greater drug-related toxicities in an organ system according to the common terminology criteria for adverse events. Tolerability was defined as a percent of patients who completed the dosing regimen without drug-related serious adverse events. For secondary objectives, histologic regression was measured by regression to L-cell or no dysplasia detected by HRA and anal cytology. HPV clearance was measured by HPV genotyping. Safety, tolerability, and demographic characteristics were summarized by descriptive statistics. Categorical data was measured by frequency. Continuous data was summarized by mean, median, and range. Our study data was captured in REDCap. In total, 29 patients were assessed for eligibility in our study. 17 patients in our study completed at least through week 16. And for the results and discussion, I'm going to have Dr. Aruradian present our data.
37% of the patients were HIV positive. The average age of the patients included was 46.5 years old. 63% of the study participants were male. 85% of the HIV positive patients were men who have sex with men. The most prevalent HPV genotype was 16, and over 50% of the patients enrolled in the study had had a previous treatment of their HSIL. The adverse events reported by the study participants were subdivided based on the doses of artesunate and the number of cycles. There were 59 drug-related adverse events. The most common side effect of the artesunate suppository was grade 1 nausea. Most of the patients who received the 600 milligram suppository reported grades 1 and 2 nausea. For the secondary objectives, each participant was evaluated post-intervention with HRA and anal pap tests. 59% of the study participants had regression of their anal HSIL, 35% had complete regression, and 24% had partial regression. 50% of the complete histologic regressors had undetectable HPV at the end of the study period. We found that the HIV negative patients had a more robust response compared to the HIV positive patients. HIV negative patients had an overall regression rate of 73% compared to 17% in the HIV positive group. The limitations to this study include a small sample size, which made it difficult to determine the therapeutic response of artesunate in the treatment of anal HSIL, and we had difficulties with recruitment of participants into our study. In summary, intra-anal artesunate is a safe and tolerable treatment for anal HSIL. Due to frequent nausea that patients experience taking the 600 milligram dose, the randomized phase 2B trial will utilize the 400 milligram suppository. We would like to thank France Viral Therapeutics and Butyryl Pharmaceuticals for supporting our study. We were fortunate to have a wonderful collaboration with the University of Wisconsin and Johns Hopkins Hospital. We'd like to express our sincere gratitude for our patients and their families. Thank you for our ability to present, and we welcome any questions, comments, or suggestions, and we are always open to embrace any future collaborations. Thank you.